Hi, welcome to Live Well with UCI Health. I'm Ryan Manno, iHeartRadio's KOST 103.5 and the LNK Morning Show. Thrilled to be joined by this gentleman here today, Dr. Gary Deng, the director of UCI Health Integrative Oncology Program. Thank you for being here. So this is very exciting. I think this is something I'm looking forward to learning more about, and I think a lot of the folks maybe watching are coming at this where I'm coming at this from. Integrative Oncology. Start from the beginning. What is that?
You have to go back like 20 years ago when people were trying to incorporate some of the non-Western treatment together with Western treatment, especially in cancer care, because cancer is very difficult to treat. And so we were integrating conventional Western medicine with, at that time, called complementary and alternative medicine, which are basically things like natural health products, herbs and supplements, acupuncture, meditation, and so on.
Right.
Over the last 20 years, there is enough research showing this actually is the integration on form. In essence, what we're integrating is what's being done to the patient from the outside and what the patient can harness from the inside.
Okay.
Because a lot of these unconventional therapies focus on make the patients do better from the inside.
Okay, so give me some examples of when you say outside and inside. What do you mean? Outside would be what, like the chemotherapy? And
like outside you got chemotherapy, you got a drug infused into your vein, radiation, surgery. Inside means you change the internal environment by changing your diet, how do you exercise, how to reduce stress, sleep, circadian rhythm, social environment.
Okay.
So these are what we call changing the ecosystem the cancer cells are living in.
Okay.
They don't live in isolation. The cancer cells don't live in isolation in thin air. They live in our body. They interact with the rest of our body. For example, what we eat, the nutrients we eat, expose every cell in the body, including cancer cells. You can make it more supportive or friendly to cancer cells, or you can make it less friendly or more hostile to cancer cells.
Okay, so this is, I've seen this phrase, the whole person integrative care, right? The whole person being the inside of the person too.
Yeah, that's what we mean by whole person, not just the cancer tissue, but your cardiovascular system, your endocrine system, your immune system, your nerve system, because all these are connected. The nerve system, your emotion change your endocrine system, change your reaction to the biological process involved in cancer. That your diet can change the microbiome, which are the bacteria living in our gut, that in turn change the immune system.
Yes.
So there are some studies showing for people who eat a high-fiber diet or people who take certain kind of probiotics, the immunotherapy works better.
Okay.
And these are both published on Science or very top journal.
So it's kind of like everything, it's a hand-in-hand thing, right?
Yeah.
The more you're taking care of the inside, the better you're going to respond to what's coming from the outside.
Exactly. So this part is overlooked historically, right? People
and I want to talk about that.
Yeah.
Go ahead. You say that, and then I have questions about that part.
Historically, it's based on our understanding of how cancer come about. So initially we thought, cancer is because the cells have the mutation genes, they grow out of control. So let's cut the mutation, kill the cancer cells, right? That was great.
Yes.
We made a lot of progress in targeting cancer cells. But in the last 10 years or so, we found the supporting environment, we call it microenvironment, and bigger theme is macroenvironment, is also important. One example is the cancer will not grow beyond the size of a sesame unless they can recruit blood vessels to support oxygen and nutrients. This is a process called angiogenesis. So there are drugs being developed to cut off angiogenesis, but then they found stress promote this angiogenesis. So they did some study in mice. When you stress the mice 2 hours a day, the tumor grew faster because the adrenaline stimulated the growth of blood vessels into tumor to support them. So what we do in integrative oncology is to use a lot of this non-drug therapy to help people reduce stress. You cannot just give people a prescription to reduce stress, like lorazepam
I wish.
or Valium.
Sure.
It works, but it's very narrow. It doesn't reduce your overall stress. It just makes you look like you're less stressed.
Yes. Okay, so did you, I don't know whether personally or overall, have you run into, when you first started all of this, right? Did you run into some skeptics or roadblocks? Like was this a tough one for you to kind of get into?
20 years ago, yes.
That's what I mean, yeah.
Now, no. Right
Okay.
now, it's become widely accepted. We have to treat cancer in the context of the whole person.
Absolutely. What was that turning point? What was it that opened people's eyes? Is it the fact that you're coming at this now with evidence, with science, with studies, with research? Is that it?
That's the major part, because a lot of the therapies we integrate from non-Western treatment has been around for hundreds, if not thousands of years, right? Like acupuncture or meditation, or how you time your eating with the day at the time of the day, the circadian rhythm.
Yeah.
And so, for example, in traditional Chinese medicine, certain hours of the day, you need to do certain things. You get up a certain hour, you go to bed, you eat each meal at a certain time. So all these are in theory by tradition.
Yes.
What made it mainstream are these scientific research. Most of them happened in the last 10 years or so. And one example for the circadian rhythm, right? In traditional Chinese medicine, we always say, oh, you should take a nap around noon, or you should sleep. Don't go to sleep after midnight. You go to sleep before midnight.
Right.
So now the people who study circadian rhythm, they found every cells in our body actually have a clock system. It's called the clock gene system.
Every cell.
Every cell. Yeah, it's universal because the sun goes up and down, and every living organism is exposed to that. So they developed that, and the people who study and discover this and study this got the Nobel Prize in, I believe, in 2017 or 2017. So that's when people say, this circadian rhythm, the timing of eating, sleeping, doing things are actually important. So you can see the scientific data correlate with what we have been practicing in some of these traditional medical systems.
Do you find, because I would bet that most people are very bad at this, that because of the nature of our crazy lives, our jobs, our go, that most people aren't mindful of what you're talking about?
Yeah. So you're cutting right to the heart of the issue. We know all these, but how to change people's behavior?
That's it. Right?
How to make people do better? The first step is to be mindful.
Yeah.
To be aware this actually is a thing. This is actually important. At UCI, there is a scientist, Dr. Masri. She studied this circadian rhythm and timing, and she found in mice models, if the mice are sleep deprived, like they sleep only 2-3 hours a day, or you're constantly changing the night-day cycle. Mice are nocturnal animals, so their cycle is reversed from us. If you constantly change that, the cancer grow faster.
Oh my God.
And immunotherapy doesn't work as well. So you can see just by changing how you do things every day, you may create an environment that suppress tumor growth and promote immune system to fight cancer. We are trying to research it in human, to move what she found in mice and convert it, translate to human. So this way we can develop better cancer treatment.
Yeah. So you mentioned how every cell has a clock, and pardon my ignorance on this. Is my clock different than your clock, or is it relatively the same?
Most people are the same, but then you got the night owl whose clock is different. But each one of us have our own rhythm. So my advice usually to our patients, the first step is just don't keep changing day by day.
Okay.
If you're a night person, fine. You just do that. But it's not the best for most people because our natural rhythm actually goes by the sun.
Yeah.
Imagine 5,000 years ago, the candle's expensive. There's no light. So people just go by the sun. The sun goes up, you start to be active. When the sun goes down,
that's it.
You go to rest. So most people have that rhythm. Of course, occasionally you have some genetic. There are people who are genetically programmed to do it differently. That's the problem with our modern life, which we're all short on time. You have too many things to do. The first thing you cut is actually your sleep time. You just stay up later, and then get up in the morning feeling not.
Here's what I found though about that. So I'm speaking from experience. I bet you everyone knows this. Like when you try to operate the next day on little sleep, your performance is worse that next day, and you don't get as much done. You feel you never quite catch up when you start from a deficit.
Yeah,
right.
There's something called the sleep debt, right? So we always say, well, during the weekdays, if you're short, you're sleep deprived. During the weekend, you must catch up.
Right.
You're sleeping. You kind of
and I do that. Yeah.
Great. So that's what sustains people.
Okay.
So what you don't want is you wake up at an alarm clock.
Yeah.
And then you have a cup of coffee. Without a cup of coffee, you cannot function. That by itself tells me you're sleep deprived. You didn't get all the sleep you needed.
Yeah.
So I usually advise patients, if you set an alarm, do not set it to 6 a.m., set it to 10 p.m. So when the alarm goes off, you said, I need to go to bed now.
Oh.
So you go to bed
So
early.
you set a bedtime alarm.
Exactly.
What? That's
right,
crazy. Yes.
Right? But think about it, it actually makes sense.
Yes.
So this way you guarantee your number of hours of sleep.
Yeah.
And because over time, your performance will deteriorate.
Right.
There are all kinds of associations, like lack of sleep with Alzheimer's, cardiovascular disease, cancer, all that.
It's incredible. So sleep, we've covered sleep. That's one part of it. What are some other things that you focus on, right, in integrative oncology?
A lot is, we call it the 6 pillars for the foundation of human health.
Oh, let's talk about them. Yeah.
Diet, exercise, stress management, sleep, which recovered, and social environment. In the same experiment they did, when they isolated mice, the tumor grew faster as well. So the last part is often overlooked is what we call the joy and meaning in life, which means you have to introduce something positive in your daily life, not just avoiding the negative, I don't want cancer to grow, I don't want this, but do you have any hobby? Are you doing it today?
Yeah.
Do you have anything that made you laugh today, right? Do you find what your work or how you spend your time is meaningful?
Yes.
So those are the 6 pillars.
And it's so fascinating because I feel like, I'm guilty of this. I would listen to someone say this and I wouldn't associate them with necessarily medically backed. But what you're telling us is that there is research to support that you need these things.
Yeah, I think it's just not widely known to the public.
Yes.
There's research on all 6 of them, the 6 pillars. So I use another example. I just gave a talk to a nutrition conference over the weekend talking about the role of nutrients plays in cancer prevention, cancer during cancer treatment, and after cancer treatment survivorship, right? So there are a lot of studies showing, back in the 80s, they found like 30% of cancer is actually related to diet. Yeah. Obesity is clearly linked with higher risk of breast cancer, colon cancer, prostate cancer, especially uterine cancer. So in prevention, nutrition is important. Even during treatment, they found people who take a more like a Mediterranean diet, they tend to have a lower risk of cancer to begin with. And if they eat healthy rather than eating junk food, they tolerate chemotherapy better. And eventually they have lower recurrence because they can withstand the full course of chemo. So they got a maximum benefit.
Yeah.
And then they found patients who eat a high fiber diet, again, the immunotherapy works better.
Yeah.
So you can see diet is a major part and the physical activity. And they also found recently, last year, there was a big paper published on New England Journal of Medicine. They found colon cancer survivors who exercise regularly, rigorously, their risk of recurrence is lower. And everything else being equal, just exercise will help you reduce cancer recurrence.
Any specific exercise or just staying active?
Yeah, so there's a very active field of exercise here in terms of frequency, modality, intensity, duration, right? So there are all these variables there. And the current consensus is frequency is the most important.
Okay.
You do a little bit every day. It's better than doing nothing during the weekdays and then run a marathon in the weekend.
Yeah.
So a little bit every day. It's like we eat good food. You eat healthy food every day rather than I eat junk during the weekend and eat some healthy food in the weekend.
Yeah.
That's not going to work.
Right.
So frequency every day.
Yeah.
Intensity, moderate intensity. You don't have to run a 5K. Just bring your heart rate up a little bit and sustain it for 30 minutes. That appears to be the most doable ones, practical. And then what's interesting, this is the interesting part. I was always wondering what kind of exercise is the best.
Yeah.
Is this swimming or walking? Initially, a lot of people are doing jogging. Initially, I thought swimming. Because swimming, you exercise both the upper body, lower body. You exercise the cardiovascular, also resistant.
No
right?
strain on your joints, right?
Yeah. So, but then the data actually said otherwise.
Oh.
So the data supports. Can you guess which one would be the best?
Gosh, running.
Okay. Do you like tennis or pickleball?
I used to play tennis in high school. Yeah.
So they found racket sports is the best.
Really?
Yeah. Surprising, right? So this came from the Danish study. In Danish, they track these people, different kind of exercise they do, and they track the lifespan, extension of lifespan. On the baseline, people who don't exercise, and let's say one, people who do racket sports regularly, tennis, racquetball, squash, nowadays pickleball, they extend the lifespan by 9 years. People who do swimming and so on, it's more like 5 to 7 years. You just do regular walking, 3 years. So a little bit of exercise will already extend your lifespan, but racket sports appears to be associated with the longest extension.
That's incredible.
Can you guess why?
I can't. I'm trying to rack my brain. I mean, is it because of the constant moving side to side? You're using all muscles. Your heart rate is up. It's kind of a full body workout.
Exactly. So because it's not the same. If you do jogging, it's always the same.
Yeah, it's the same motion.
Yeah.
Same
so
with swimming.
here, your heart rate goes up and down. So you're actually training your autonomic nervous system.
Okay.
Going up
that
and
makes
down.
sense.
And then you keep changing the directions. So every time you change direction, you actually stimulate your bone and muscle. You're stopping and going.
Yeah.
And there's another big component there, which is often overlooked in exercise science or exercise practice. It's a social environment, a social component. You cannot play tennis or racquetball by yourself, right? You have to find a partner. You have the group. So you do it in group, which number one will sustain you because, you need to come play tennis with me every weekend, every Saturday, right? So that, otherwise you'll just say, I don't want to go around. I just stay home.
Yeah.
So the social environment make you more likely to do it.
I'll tell you right now, whenever I have to go to the gym, I don't go unless someone says we're going.
Exactly.
Yeah.
So you can see the importance of social determinants in our lifestyle. The second one is the socialization itself is therapeutic.
Yep.
As I mentioned, in mice, if you isolate the mice, the tumor grow faster because they're stressed. In human being, we're social animals. So if you have social, you have friends, and do exercise together, it gives you extended lifespan. So you can see there are all these very interesting things that are not known to the public.
Yes. And I hope they start to become more known because this is fascinating and that they're proven. So at what point in someone, let's say someone was, I don't know, recently diagnosed, at what point would you recommend someone, seek out an integrative oncology approach?
Upon diagnosis,
really?
Or better yet, even before, right?
Yeah.
So we want everyone in the general population to adapt this kind of healthy, whole person approach to their health.
Yeah.
But from our work at UCI Cancer Care, UCI Health, the cancer center, we try to engage our patients at the beginning, the moment they're diagnosed, for many reasons. Number one, they're going through a tremendous stress. A healthy person diagnosed with cancer, they think, this is a very serious disease, so they're under a lot of stress.
Right.
And we need to give them the tools, not just medication. We teach them mind-body meditation and so on, so they stay strong and they can deal with the anxiety and stress. And secondly, we prepare them for nutrition, so they have upcoming surgery or chemo. We want to give them the right diet, so internally they're healthy. They don't have a lot of waste or junk circulating.
Yeah.
And we want to get them into our exercise regimen so they can start to build up their muscles and so on. So integrative oncology should be implemented at the beginning of diagnosis. That's not the case at this point.
Yeah.
And I think UCI Health is taking a leadership role in trying to make that happen.
Yeah. And so then you, specifically then with what you do, you work in tandem, pretty hand in hand with their actual day-to-day care team?
Yes.
You're part of that team.
Yeah, I'm part of that. So my clinic is also in the same building in the UCI Health Irvine Cancer Center.
Yeah.
So a lot of our patients are referred by my colleagues, oncology colleagues. So we work together. Our vision is for patients diagnosed with cancer, they got their regular standard treatment, surgery, chemo, radiation. At UCI Health, they also pair up with integrative oncology, where we hold their hands from the beginning of the diagnosis through treatment, through survivorship. We optimize their lifestyle, build a foundation of the whole person wellness. And we do that with a lot of these therapies, for example, natural therapies, for example, dietary plan, exercise regimen, including yoga, tai chi, because those are not pure exercise. They also make your mind more resilient, right?
Yeah.
So how to reduce stress. And we teach people how to do these behavior changes that promote better sleep. So our vision is to have every UCI patient, cancer patient, to have the opportunity to take advantage of this.
I love this. And I would think, if I'm going through that, I would think even just knowing that exists almost acts as a de-stressor from the outset, right?
Yeah.
Because I wouldn't expect to have someone like you walk in and say, hey, we're gonna treat you like the full person too.
Yeah, usually their first visit is, you have a serious disease.
Yes.
We're going to cut you open, remove the tumor, or we're going to give you a very strong drug like chemotherapy. Naturally, people are fearful. There's so much unknown. And then we come in, we say, yeah, we have to do this, but there are a lot of things you can do yourself to help yourself, right? Not only reduce these symptoms and anxiety, but actually you're contributing to your own treatment. As I mentioned, if you reduce stress, your therapeutic effect may be even better. So you can see how much this way of thinking of cancer care is in one side innovative, on the other side, common sense. It just makes sense.
It does, yeah. Do you have your hands in or your eyes on some exciting research right now?
Yeah, we're doing a lot of research because that's the only way to push the field forward.
Yep.
So I have several projects. One is I'm running a clinical trials supported by National Cancer Institute using acupuncture to treat patients hospitalized and they develop early signs of sepsis.
Okay. Sepsis
carries are like 20% mortality rate, one of the most common cause of death in the hospital. And so there are mice study, animal studies showing if you do acupuncture at a certain point, you actually suppress the inflammation and you reduce the mortality. Sepsis. So we're doing this in human, and we have some very encouraging data that's probably going to be reported in the next few months, showing this can be a potential therapy. So that's important because we're using acupuncture not only just to reduce symptoms, headache, nausea, vomiting, we're actually trying to save life and extend life. So that's one line of the research I'm doing on specific integrated therapies. And I also did other studies on yoga for chemo brain and botanical herbs for other immune system and so on. So the second line of research is outcome. So we're trying to implement this whole person health index to patients. This is a 9-question asking you about the things I just mentioned, like diet, exercise, stress, social, and so on. And we want to collect this data and track them throughout their cancer course and see whether what we're doing improve their health at the whole person level. Not just, are we reducing your pain? We actually look at the 9 dimensions of your whole person health.
Yeah.
So that will be a direction of research. Later, we can find what therapy or what package of therapy would be the best for that.
Yeah.
And the third line of research is on natural products, herbs and supplements. Because there's a lot of concern taking herbs together with chemo may interact with each other. Some may interact, some may not. But nobody knows exactly which one will interact, which one is not. If you look at the literature, it's just all over the place.
Sure.
So we are doing a systematic review so we can offer clarity. So later we can say, this drug, this herb will not interact with this drug. This herb will interact with that drug.
Yep.
And here's the data. So nobody will say, they say, okay, yeah, you're right. So this is data, evidence-driven clarity in the use of herb together with chemo.
Because I think right now every drug, right, every Western drug has interactive warning, right? This interacts with this and that. But the herbs they don't have that.
Yeah, because the data is not complete and also scattered. And
so you're creating this.
It's our job to create it.
It's unbelievable.
So we'll have a database, hopefully also a handheld tool for oncologists. They put in the name of the herbs and drug. We'll say this will interact, and I'll tell you the certainty. We are very sure this is going to interact, or we're not too sure.
Yeah.
So this will be a very good tool for practicing oncologists.
Yeah. So obviously, I mean, you're at the forefront of this thing, not just you, but UCI Health. Do you see this starting to be maybe adopted on like a daily basis by other outfits looking at you going, this Deng guy's on top of this. Like we got to copy this guy.
So that's one of our goal. Our mission is to make it not only we not only demonstrate the efficacy benefit to patients. Also, we try to build a new cancer care model that can be implemented, scalable model that can be implemented by other and used in other cancer centers.
Yeah.
So that's our goal, and we are embarking on that. So a lot of things we're doing always have this scalability in mind.
Yep.
We don't want to just treat one patient. Yeah, we make one patient better, great. But to change the whole cancer care, we want to design, implement, investigate, and deploy and disseminate this new model.
Yeah, fascinating. I mean, really, it's really, that's so cool. You're changing the face of cancer treatment, right? I mean, you really are.
The way cancer is treated. Historically, it's always just cancer therapeutics. We want to shrink the tumor, get rid of the tumor. But there are a lot of other things in the patients that need to be taken care of. Also, when you make them do better, your ability to shrink tumor or get rid of tumor is also enhanced.
So then you're getting more success as the one shrinking the tumor. You're finding better results for what it is that you've even set out to do.
Yeah.
That's incredible.
Yeah.
How excited are you just personally, like as just you, Dr. Deng, to be kind of right here, right now, right? Like you're living through this thing that's happening.
Yeah.
Is that exciting to you?
It's very exciting.
Yeah.
So I'm so glad I moved here. I used to work in New York City at Sloan Kettering Memorial Sloan Kettering Cancer Center.
Yeah.
So I moved here. Number one, I love the weather here.
Of course.
So I bike to work every day, back and forth.
Yep.
And this is perfect weather for biking because otherwise it was such a waste, right?
Mm-hmm.
So weather is great, and the environment, the UCI environment, because they're very open-minded, they're very supportive. They are always open to new ideas and trying to develop something that's paradigm shifting, thinking big rather than just improving things incrementally. So I think I'm in a very supportive, fertile environment for my career and for the whole field.
Yeah.
So I'm just so happy and excited to be here.
Did you always know that this was kind of the avenue you wanted to take? Like when you first started studying medicine, did you know that it was kind of, this was where it was going to lead you, or did you hope it would?
Somewhat, yeah. Because when I was doing my residency at University of Texas, Houston, I was fortunate to have a great mentor.
Yeah.
He's a so-called master of American College of Physicians. There are only a handful of masters. So what he told us is when you look at the patients, don't look at the medical diagnosis only. Don't follow just what's on the textbook and stop there. You will dig a little deeper to see what's happening in the patient's life. Because what they're doing in their life actually change their health and medical problem. Yeah. For example, I always use this example because it's a very clear, easy to understand example. When we admit a patient overnight, coming with congestive heart failure and shortness of breath. So in the morning, during the morning report, we give the report to this master of internal medicine. He will always ask us, what's the diagnosis? What's the problem? What's the diagnosis?
Okay.
According to the medical textbook, the problem is shortness of breath.
Right.
The patient cannot breathe. The diagnosis, congestive heart failure. You have an organ failure. And he said, no, that's not. That's the surface. The diagnosis, the problem is actually the congestive heart failure. The diagnosis, the patient ate a lot of salt last week.
Yeah.
That's the root of the problem. Otherwise, the patient would have a borderline heart dysfunction, but would not go into congenital heart failure. So he said, he always helped us to dig a little deeper and know the patients as a person, not as an organ or cell, as a person in the context of their life. What's happening in their life? So I got a lot of influence on that. And then when we start to practice medicine, we notice the current limitation, right? It's always, you have a headache, I give you a Tylenol. You have this problem, I give you antibiotics.
Sure.
But there are a lot more things we can do as a healthcare professional to patients in addition to this very linear way.
I love
that. So that's where I started to get interested in this. And then I was just lucky and fortunate that at that time, this whole field started to pop up and
get some
start to
attention.
grow.
Yeah.
And I just caught the wave of this field.
Heck yeah. And now you're riding that wave. I love it.
Yeah.
What advice, and we'll wrap on this, what do you say to someone who's maybe been newly diagnosed, right, with cancer? They're afraid. They don't know what's next. They don't know, really what tomorrow brings.
So the first thing I would say is cancer is not one disease. It's about 150 different diseases. Some have very poor prognosis. Some actually is totally treatable or curable. So that's the first thing. Most people, when they hear cancer, they think it's like a death sentence. And nowadays and age, most of them are not. right? Because they're early diagnosed, you can cure them. So that's the first thing. Recognize cancer is not one single disease, right? It's more than 100 different diseases with different outcome. So you're less fearful. Number two, learn some skills to cultivate this ability inside of you that you can deal with the stress. You can deal with the stressor without being stressed. Stress comes from our reaction to stressors. So we teach people these mind-body meditation techniques, and also there are other behavior changes that will make patients see, okay, I have cancer, we're going to deal with it, but I don't constantly think about the worst case scenario. I may die and so on, right? Which is unlikely to happen for most cancer. But patients are not aware of that. So we want to give patients the tools, the confidence, and the specific measures to overcome that.
Yeah. Look, I've done a lot of these with a lot of different doctors. You're the first one who says, set a bedtime alarm, get a hobby, play pickleball, and make some friends. I mean, that's a great prescription, doctor.
Very simple and costs nothing for you.
I know. It's so great. And really, congrats on not only being here at UCI, but like all the work that you're pioneering. Really, it's awesome.
It's a pleasure talking to you. You're so incisive. You always cut down to the to the heart of the issue.
Well, you're fascinating, Doctor. Thank you so much, Dr. Deng. It is Live Well, UCI Health. Thanks for watching.